You're running a successful private practice in beautiful Palma de Mallorca.
And you give it back to the audience, which is quite amazing. So was this from the get-go like this?
No, I think I learned a lot. And you all will agree that by doing it, you can get better. I'm not so much a creative person, but if there is something coming up, then I will be the one who's going to lead that and we will get the work done.
Welcome to Straumann ProTalk. Welcome to the Pulse of Dentistry. Welcome to the IDS. We are recording this episode directly from the IDS, and today I have the pleasure with George, my co-host, to welcome Dr. Laurence Adriaens from beautiful Palma de Mallorca. Welcome, Laurence. Welcome, George.
Welcome.
Welcome you too as well.
So I said we are recording this from directly the IDS, and I can tell you the excitement level here at the IDS is super high, and we are super pleased to have you today, Laurence. Laurence, you are running a successful private practice in beautiful Palma de Mallorca. You are a periodontist and an implantologist by training, and that's also the focus of your work that you do. And you are very active also in speaking. You are very active also in communities, in the ITI and the WIN community. We come to this later. So you're a very active person. But, introduce yourself in 1 minute. Who is Laurence Adriaens to the audience?
Okay, thank you for the question and the nice introduction already that you gave. If I talk about myself, I think I would like to stress the fact that I'm a very active person, as you already stressed. For me, activity is something that gives me also a good energy. So sitting in the sofa, as already Ronald also said in his episode, is not something that you will see me do very often. And I am a doer. I'm not so much a creative person, but if there is something coming up as a creation and we know how it will go down, then I will be the one who's going to lead that and we will get the work done. So this is very interesting, not only in my professional life, but also in my personal life. And another thing that I would like to also share with you is that I like to be taking care of people, taking care in my own way of people around me, in my, again, personal life, professional life, because I think when we talk about patients, who really likes to come to your practice? I mean, they don't feel like very comfortable very often. It's sometimes painful. So I like to create this bond with my patient and to empathize. I think that's very, very interesting and very necessary. And more today that sometimes our communities, we're all closed up in our phones or closed up in our iPads and our computers so that we still have this human contact with them. We're placing and doing treatments or placing implants, doing treatments, very complex treatments sometimes, but we're treating patients. It's human beings that we're talking about. So I think that this is also something that is very important that we do every day. And I am also a mom of 2 beautiful boys, Theo and Hugo. They're almost 9 and 11, so they also give me a lot of joy. And something that is also very nice that I have as a talent is that I speak many languages. So also in Palma, we have an international community, so we can get to a lot of patients.
Okay, I can sense a lot of passion for, the field of dentistry, for the community also, but also for contributing. So I think in the course of this podcast, it will be a lot about leadership, about achieving. It will be about mentorship, and we will speak also about the future of dentistry. So looking forward to this, Laurence. One thing that you did not mention when introducing yourself is you also learned from some really great mentors, from some of the greatest, I would say, as an example, from Niklas Lang in Bern. You spent quite some time with him. So what is it that you learned from him and maybe from other great mentors, and what was the influence from these mentors to you as a person and your career?
Okay. I think the very first mentor and the very first example that I would like to address here with this question is also the influence of my dad. I'm a 4th generation dentist, so it comes along the genes almost, you would think. Yes. And my dad has been somebody who also helped me out. He never pushed me to get into the field, but he helped me out. And he said, look, if you want to do this, then just do it because you want to do it, not because I am already somebody in that field, but you like to have this kind of passion that you feel about it, and then also share it with the people around you. And obviously, Klaus, for me, it's a very important person during the master that I've been doing in Bern. He is a very generous person. A very generous person in the way that he likes to create a family feeling in his team. And again, also stressing the importance of being a team. A team is respecting the other ones, is growing with the other ones, and it's learning from the other ones. So he didn't only do that on a professional level with us in the university, but he took us also outside of the university to get the team building going on in activities outdoors, a weekend long. So it was really nice to feel that when you get into a new area, because it's Bern, I'm from Belgium originally, I moved to a new place. As so many other ones that were in that master, just as me, we left home, we left friends, we left family behind. But then he creates this kind of family feeling so that you feel good. And this is then much easier to go on.
Yes. So you said you were born and raised in beautiful Belgium. You ended up now in beautiful Palma. If you're looking back in your career, what was the most magic or defining moment in your career that changed everything?
I think I have to go back there when I finished dental school and go back a little bit again to my dad, to my father. He gave me the opportunity because at the time when I finished dental school, I was not really sure I wanted to get into periodontology. So he gave me the opportunity for 2 months to leave the country, to go to New York and spend some time in New York in private practices of friends of his, colleagues of his, and also had the opportunity to visit 3 different universities. So with this kind of contacts and this kind of experience that I got there, I then came back home and I told him, look, I really want to get into a Master of Periodontology. Now, to get into a Master of Periodontology, it's not just knock, knock, and I want to start. You just have to go through a certain pathway. They ask you also professional experience. So I worked for 1 year in between 2 practices, the practice of my dad and one in Holland. And then I left off and I had this amazing experience with Sandro Cortellini for 1 year in Florence. He is a very nice person, a very dedicated person, inspired me a lot. And these 2 years with different experiences gave me then the possibility to get into the program that Klaus Lang at the time was directing at the University of Bern. And there my journey starts.
So it's a really broad and deep education, learning from a lot of great people in the field, and all starting with your dad. Mm-hmm. That's a great story. So you said, you're running a practice, you're active as a speaker, you are passionate about the community, you have 2 boys, you have a husband, you're very busy. How do you manage your energy? Where do you get your energy from?
Well, I think it's something innate. It's who I am. But I am also a very positive person. So I think the energy that I find around me in positive experiences and positive connections with people could be people that I've known for a long time, friends for a lifetime, new friends, could be also new colleagues in the field. And I think this gives me this kind of energy that pushes me up. And also my patients who are so happy and show their gratitude when, for example, their periodontal status has completely changed and they really tell me, look, I did not know that this could happen. So this shift and this well-being that you can give to your patients, that gives me also a lot of energy.
I can relate to this. I think it's a beautiful purpose that, this profession has, to doing good for patients and to really change the life of patients and to
exactly.
improve the quality of life for your patients. That's really beautiful. A new thing that we want to do is we have a question. We got a question from our followers on Instagram, and it's actually, I think, someone that you know. It's Dr. Carme Riera, and she asked a question. I have to read it. How is it to be a lecturer woman on the field of implant dentistry? Can you share an anecdote? And I think she's probably referring to the fact that it's a quite male-dominated world, especially if it comes to speakers. So it's very refreshing to have you on stage. Yeah. How is this?
So the experiences of speaking in front of a public, and especially in this male-dominating field, which is implantology, which is related to surgery, it can be very intimidating, but I think you have your story to tell and you have your experiences to share. So don't think too much about what's going on around you. Just go for what you want to show. And it's very nice to be up there and to be a kind of example for other women, to be a kind of role model, that we still not have enough to maybe incite these ladies, because there's plenty of female dentists, studying dentists, that will become then graduating dentists, licensed dentists, who can then start to search for a new pathway, go into a kind of specialty. And I would love them to choose this implantology direction, because we can do this. We can. If you really believe in yourself, you can do this. And it's very nice, because I think we have a community, and we will talk about this community, that is growing and that can give support to women who want to get more and more involved. So it's demanding, yes, because you have to be a kind of example, but you have to be a reachable example. I know maybe not everybody has the same energy and has the same motivation and the same passion, but I think they can pick up something from who you are and then maybe work further with that and then get into the next level.
It's a really great question. I love this question because and you said it, I agree, you're a great role model for female speakers in implant dentistry, and I would like the community to learn a little bit from you. So how did you start? What was your first step?
The very, very first step was during my master still. And then you do some presentations in front of the students that you're studying together with. But then we had to go to the Europerio 2005 in Madrid. I was doing a research project, and our professor told us, look, the ones who are in their research project, they should give some explanation in front of all the other EFP program introduced students. So this was the first time that I had a public in front of me that I did not really know, that was not familiar. And then from there, it's true that in 2008, I moved to Palma. We started a private practice. And then I got involved little by little also. For example, the next talk I did was in Europerio 2009 in front of the dental hygienist community. It was a very nice experience as well. Big audience, very impressive, but it worked out fine. So little by little also in the national community from Spain, I got introduced, because I'm not from Spain originally, but they really supported me. And the first one who supported me was Fernando. He got the contacts. He got already in CEPA, for example. He got contacts already in the Straumann area as well of Spain. So little by little, he introduced me there, and I could also be part of that community. And then it was a very nice moment also in 2009. We did, together with Straumann and Klaus Lang in Palma, a first kind of symposium. And there I spoke for the first time also in my new native language, or my new, adopted language, yes, exactly. And I was Spanish, and that was really a challenge for me.
I can imagine, yeah.
Mm-hmm.
We spoke about, what gives you energy, and seeing you on stage. I think it's fair to say that this is also something that gives you energy, actually. So, and you give it back to the audience, which is quite amazing. So was this from the get-go like this, or did you actually grow into, being very present on stage and be comfortable on stage?
No, I think I learned a lot. And you all will agree that by doing it, you can get better, okay? And also this community that we will then talk a little bit more about, they offered me possibilities to do some workshops around how to present in public. So you take little tips with you along the road that you get from people around you. You see others also presenting. You get some ideas, and then you start to make your own kind of product. And that's how it works for me.
And I think that's also an important message. So this is something that can be learned to a certain extent. I think it needs a basic level of confidence, but then also,
Exactly.
The tips and tricks, they can make a difference. So.
Yes, they can. And it's very small things. I mean, it's maybe knowing that you can move with the hands, that you can contact with the people, that you have this eye contact, that you can smile, that you can make a joke, that you can just be who you are and give it a personal touch.
The first time I saw you on stage was at Young Professional European Young Professional Symposium, I still remember, in Amsterdam. I think that was 2017. And by that time, I thought you've been a quite complete speaker already. So I think it's about what you said. It's about getting started and have the courage to do so and to find your own way. So I hope that's very inspiring for the people listening to this podcast. Another thing that I see you doing is you are very active on social media. So you try to extend your reach with your social media profile. How do you look at this channel? What is your recommendation to the young opinion leaders out there?
I'm happy that you asked this question because I'm a person who got really, really, really late into those kind of channels. I was not at all into Facebook. I was not at all into Instagram until 2018, the end of 2018. And the reason that I got into those channels was due to WIN, the Women Implantology Network. Because I understood that if I wanted to reach kind of community that was out there at a global level, then I needed to be visible. And I needed to be somebody that they could relate to and that they could follow or see how I was working and how I was doing things so that they also could learn. So this was for me the bigger step. But I think it's a good tool to use, but it's not the only tool to use, okay? And being part of the ITI, which is a really amazing community, I think young people should also invest in a community that can support them, not only at the level of education, but also with an amazing network and amazing professionals. So combining those two, I think this can get you as an opinion leader very far.
Do you think a young opinion leader could work without a social media account?
I think not so much anymore nowadays. I think it's really necessary. We need to reach, and the reachability that we get with this kind of media is amazing. It's amazing.
In your last answer, you mentioned, and in the beginning, you mentioned Women in Implantology Network. You've been a founding member of this, and you are still very active there. You are leading the Spanish group as an example, and you're mentoring a lot of females in this network. Tell us more, what is the network about, and how do young female clinicians benefit from it?
So Women Implantology Network, it all started in 2016 in Zurich. We were invited, different women from international backgrounds, also from different continents, to start to get together and grow kind of network. A network where we could support women and to get those women also much more in the spotlight, get more visibility, and to create a kind of role model in different countries. So then I became this kind of role model in Spain. And we started to look for women who could be interested, who could feel that they could be supported by this network and grow with this network. So now we have, I think, 10 to 15 ambassadors in the WIN Spain community. And we are very active, again, using social media. And on the other hand side now, recently we introduced a kind of WIN Circle community. The WIN Circle community is to attract on a local base the women that are in the area. For example, I have colleagues who are in Madrid, I have colleagues who are in Bilbao, I have colleagues in the south of Spain, that in those local areas, women who would be interested to get together, to get to know more about implants, to get to know more about how we can maybe present a case, how we document a case, and so on, that they can have this small community to fall back onto and to feel comfortable moving in that circle. Because I think a lot of us as women, and I'm the first one when I was sitting there in that first meeting in 2016 in Zurich thinking, how is it that I have this feeling that I cannot do this? Why do I feel this feeling that I am not capable of some things? I think we put sometimes too much stress on ourselves and we underestimate what we are able of. It's true that we like to have support. And I am the first one who likes to have support around me. I had it in the beginning from my father, then I got it from my mentors, and now I have it also with my partner, Fernando Frank, in our clinic. I mean, both of us, it's nice to have this support. And you can get that therefrom, I also get my energy.
Yeah, and you
So I
grow
think-
together. Huh?
Yes, and you grow together.
Yes.
Mhm.
So, to close this section, what is your message to young, female, talented clinicians that would like to lecture, share, and to be on stage?
Okay. I think the most important thing is just go for it. Try it. If in the end it's nothing that you feel like makes you happy, then let it be. But if you don't try it, you will never know. And this WIN community is there to support you, is there to help you. If you need maybe some more experience how to present in a public or in front of a public, then you can talk to us. Do you need to know more about how constructing a keynote or a PowerPoint presentation? You can fall back on us. You can contact us. We are there. We are physically there. So, and we give an answer back. Even though if you're on the other side of the planet, we have a global community as well. So this is the nice thing about it. But just try. Don't be scared, I would say. If you don't try, you will never know.
No, I like that. Maybe for the ones that are not knowing the WIN network, and I think you can be very proud of this, Laurence. The WIN network became a movement of thousands of females in implant dentistry, and we are very happy to see evolving a lot of young talents in this network. So a very exciting network to join.
Yes, because I think there are a lot of, like we tell them, you're hidden gems. You are working every day. You're producing really nice things, but then we need to get it out there. And we need to get it in front of the public that you can share your experiences, that they can learn from you. But the thing and the nice thing of being on stage as well that I like is that I learned so much from them. So this is
You get
a
back.
win-win.
Yeah.
A win-win situation. Win-win.
Great. So beyond WIN, let's go to another topic that I think is a big passion of yours. It's implantology. And particularly, I mean, we're here at IDS, and at IDS there's always the news about technological advancements. Maybe let's talk a bit about your adoption of digital technology for your workflows. Can you share a bit, what was your journey, and how did you start? And maybe also, in hindsight, what would you have done differently if you had to start over again?
Okay. So I think here I have to give a lot of credit to Fernando. Fernando is a creative person, is somebody who comes up with ideas, who looks around, who sees things, who captures things. He goes through a time of pros and contras and why would I do it, why would I not do it? And then there is a decision made. So he then decides. He obviously talks to me. I mean, we're both of us in
You're
the
a team,
practice.
exactly,
There is a
yeah.
team. But the idea very often comes from him. So then it comes into the practice, and that's the digital journey for us started like 5 years ago. And we did it in a gradual way. So what happened is that from a specialist practice, periodontology, implantology, we had to make a turnover and go much more into a multidisciplinary treatment kind of practice concept. So we started to treat also our patients using orthodontics, working with orthodontists in our own practice. And especially when we saw that the aligners were coming into play, also the obtaining the information and the registers of the patients was much more comfortable with an intraoral scanner. So it was cleaner, it was faster, it was more comfortable. So we took that in the practice. They started to work with us, or the orthodontists started to work in the first place with that tool. And then we started to see things that we liked about this new tool. It's a very visual tool. You can show the patient. It's like as if the patient is sitting on his own tongue and they can look inside, outside, on top of their teeth if you show it in the models that you make.
They understand what's going to happen
Exactly.
with them.
They are feeling much more part of their treatment. Exactly. So the next thing is that Fernando sees, okay, now maybe also those traditional wax subs that we're doing, we can maybe use some digital planning, then also use some softwares, introduce there. Also the tools that we have to design and then do those chairside treatments with, for example, milled reconstructions. So there we'd get another move going on. And then obviously lately, I think a very big move has been in the last 2 years, is that we've been seeing that there is software out there that can give an even more visual way of the end result of a treatment. And then I'm talking obviously about SmileCloud. SmileCloud is amazing. It's amazing to show what we can get from a final result. And on the other hand side, it's an amazing platform because you can put all the information together and you can communicate with the different specialists, the different professionals. Even the patient can get onto that platform and see what's going on if he really wants to be part of this. Planning software, obviously co-diagnostics, is something that we cannot live anymore without. So the last 5 years, gradually, we've been moving and we've introduced all those tools. And I think we now almost can say that we're fully digital in the practice.
What is the next step you envision now that you said the last 5 years you evolved? What is the natural next step for you?
That's a funny question that you ask. And I talked a little bit about that with Fernando as well. So we were there like, yeah, what would be what is it all about? This robotics and the falcon. But then again, you have to understand that we at some point also still rely on the fact that freehand is also okay. So now the combination, what we've learned in the past with the new technologies involved, I think what we really want to do in the next couple of years is to improve and optimize our workflows that we have nowadays, that we still can refine, and that we even can get better outcomes and even better treatment results. And then I really like to talk it in that way, that over time will last. Because for us, long-term results,
matters.
It matters a lot to us.
Now, what would you advise to a practice that is just about to start their transformation?
Okay.
What's a good entry point that they could, get easy into and not be overwhelmed with all the possibilities?
Yes. I think there are basically two things that you cannot start anymore to use as a new private practice owner. You have to obviously have a CBCT scan, because you find so much more relevant information. You can avoid so many things that you might not have seen on the traditional 2D kind of radiographs that we had before, and in combination with an intraoral scanner. I think these two tools, if you want to start to get into the digitalization for your own practice, are the most important ones to start off with. Because then, if you do have this idea of going a step further, for example, into guided surgery, then you have this really nice concept, the smile in a box concept. With these two tools, you can get one
it's
step
the entry
further.
door, basically.
Yes, and you don't necessarily have to, from the start, also invest in the softwares that go along with the planning, the designing, and the executing of those surgical treatments that are guided.
We talked before about your experience, how important the team is. That with Klaus Long, you also learned how important it is to get along with each other and to build on each other. Now, with digital transformation, it also has a lot to do with the teamwork. So how do you manage that you bring your team along and that it's not just about you being at the forerunner, basically, but you also depend on the whole practice to transform? How do you do this?
Yes, I think we're very down to earth. We're very down to earth in our practice. And when we introduce something new, we are learning just as much as we are asking them to learn. So we introduce the team from the start. It's not that we are going to do all the details and get all the little things figured out. We will figure it out together. And I think that makes that the team sees that, you make this failure? Oh, because I made the same failure. But from our failures, we then get again into a positive kind of flow that we can build on top of each other. So I think even though some of our team players are maybe a little bit like, scared that we have something new and now we have to learn again a new protocol and we have already so many things going on in the practice. I think as we do it all together, it doesn't feel that difficult. And there is a kind of learning curve. I'm not going to say that there is not. And you lose time and you are then suddenly late for a next patient, but it's worth it. Yeah. And we explain it as well to them that they're part of this. And then the very nice thing is that we see also that they are eager to then learn even more, or that they say, you know what? I want to get a little bit more involved in the digital printing. So I'll take that for me. I will investigate a little bit. And then if I need some
Bring
help,
it back
then
to the team
yes,
to discuss it. Yeah,
exactly.
That's great.
So
yeah.
this is really nice.
Now, this technology is not there for technology's sake. So it's supposed to actually solve problems. And going back or looking a bit into the future, what do you think is one of the most underestimated challenges still to be solved in implantology? And how could technology actually help to do this?
So for me, if I think when I'm thinking of my own practice, the challenges that we meet on almost a daily basis are sometimes complications that are happening, could be around implants, could be also around teeth. I mean, we have both constructions in the mouth. And what I really would like to join, or that people would join me in this kind of thinking, is that over time, what we would like to do is to reduce these complications. So when you get into implant dentistry, I would ask people to do it in a responsible way, to get a proper training, to get proper support from people around them that have experience. You don't need to always try it out yourself. We have other people who have done that for us, so you can maybe skip those steps in the learning process and go a little bit faster, but then more in a direct way to then avoid over time problems. And I would say it in that way that I think with all the digital tools that we have out there now, and explicitly the fact that there is such a nice way to plan everything. I know that in the end, okay, we can have a plan and you can go through all the steps before you sit down and do the surgery. Then the day of the surgery comes, you have all the tools that you need. There's still sometimes unexpected things that can happen. And you need to have the basic backgrounds and the biological concepts in your mind as well. So I think basic concepts are still very important to then solve this. But I think we already have less possibility to encounter very complicated situations that we have not beforehand maybe thought of. So due to those tools, we will be able to reduce a lot more situations that now we sometimes see that the implant has been placed completely in a way that it should not be there, that then you have to think, okay, what do I do? Do I take the implant out? What are the risks of taking the implant out, especially if I am near vital other anatomic structures? If I leave the implant, what is the pro and contra to leave the implant? So it's a lot of things that I think we can just, if we step back with all these new tools and go through a nice planning and take the time and support ourselves and surround ourselves also with people who know how these things work, I think we can do a much better job even now, from now on, up to 10 years down the road.
Excellent. That makes a lot of sense. So, planning for the future and, helping to avoid complications, I think, the digital twins, they can really have a big positive impact. Now, to close that part of the session, maybe looking 10 years into the future, how do you envision dental implantology to be done in 10 years from now? What are the biggest changes and what are you looking forward to?
I think at some point, the latest changes for me that have been very important is the fact that, for example, there is this one connection, one kind of instrument that can be used for different kind of designs of implants that will make it much easier for us to work, to have it all much more protocolized and not to have this big portfolio that is sometimes a little bit complex. And I can tell you that when I started off with the implants that were mostly the tissue level implants, then to go on to the bone level implants, and then now, well, you talked about it with Daniel Buser. He talks about the hybrid implant. So there's a lot of things going on, okay? And there's a lot of things that have been changing and we needed to adapt. And happily enough, I think people and we as a humankind, we are able to adapt. And we have to adapt if we want to evolve. So maybe some structures around our implants will, I don't know if it's possible, but at the surface, for example, that we can again avoid complications over time, such as infections around these kind of structures that then are very difficult to cleanse and maybe to keep in the mouth. It's true that we, in our practice, we are pretty drastic about if an implant gets infected. We prefer to take the implant out and start over again. You cannot do that with a tooth. You take out the tooth, you cannot put the tooth in again. An implant that has been infected, you can take out the implant, wait for the human body to recuperate, and almost
restart the treatment.
Start the treatment again from zero. So I think it's also very important that people understand that that is possible. We can do procedures to regenerate maybe around it, but I still don't see exactly how it works. It's true that now there's a new instrument coming, and I'm very eager. And at the end of the week, I will be for the first time in contact with it. It's the GalvoSurge. So let's see if this is really something that can give us some hope, because it's a preoccupation. And I would like to, in the development of implants, maybe over time, to even be able to tackle that part.
So you would really like to solve the challenge of implant complications in different ways. So you already did first steps with better planning, but now it's also about, probably you get a lot of complicated cases referred, and you're confronted with, okay, how do I solve this problem, and is it still acceptable for patients to, restart the treatment?
Because these treatments are costly, and they're
Time,
also, it's a
cost,
surgery.
yeah.
It's a surgery. It's not just in and out. It's a surgery. It's already much less invasive than maybe in the past, but it's still a surgery.
Thanks a lot, Laurence. So we have a new, let's say, habit that we want to create. That's also that our guests can ask a question to us, not only us asking questions to the guests. And I know, Laurence, you have prepared a question for us.
I have one for you, yes. So my question to you would be, what is the strategy of the company to evolve as a premium product provider, and then also not only on a local basis, but also globally, obviously? And in which kind of fields of implant dentistry would you direct this evolution?
I can take this, George.
Yeah. He will take 2 hours, but it's
it's
a very good question.
It's a very good question, and obviously a question that we think about a lot.
Every day.
The way we look at this is implant dentistry is a demanding, yet very successful treatment option for practice, and patients deserve a responsible approach to it, and they deserve a long-term outcome, as I think you alluded to this. So for us to achieve this, I think there are 3 pillars that are really key and close to our heart. The first one, there's no doubt, is innovation. We still believe that there's a lot of stuff that we can innovate, and we can still improve the treatments, the treatment quality, the treatment efficiency, the treatment speed for patients, but also for clinicians. So there is innovation in technology that we can still do in material and implant componentry. We still have a lot of ideas, more ideas than we can work on, George, fortunately, that we can do. But there's also innovation in the field, of workflows, applying a lot of digital tools for planification and making implant workflows more convenient and efficient for patients, but also ultimately for clinicians. So innovation is really key in all of this, and really that's a strong belief. All of this based on scientific evidence. We're not doing innovation without proving that ultimately, the new product is a better product than what we had before. So scientific evidence is still something that we invest a lot into. Yeah. The second pillar, I think, that is very important is really education. As you said it before, we really need to make sure that everybody has the chance to provide the best possible care to patient, and this requires great products, but it requires also amazing clinical skills. And I imagine it's really difficult to approach a new patient, to identify his problem, what is the best strategy to solve this, and then applying it clinically in the field. So education is really, I would say, the second key pillar that we see. And then the third pillar that is we are very passionate about is service and support, really helping practices to be service and support, to be there when there are issues, when there are problems that we can help. Because we know also for practices, implant dentistry is one of the most demanding treatments you do every day in practice for you, but also for your team. So that's something that we feel is very important. And you mentioned also the geography dimension. Of course, implant dentistry is evolving globally. We see a lot of geographies evolving. And then this is, where in new geographies, in developing geographies, of course, we bring in great products based on science, but there we realize education and also service is key to really make sure we are starting on the right foot with implant dentistry. So, I think we could spend 2 days on this topic, and maybe we do at one point. But thanks for the great question, Laurence. So this already brings us a bit to the end of this podcast. So really enjoyed it. And a question to George, the last 30 to 40 minutes, what stood out for you with Laurence?
Well, what stood out for me, Laurence, is really your personality and how you combine your energy and your drive with the desire to meet patients' demands, needs, and expectations. So I think you're a great role model. That really stood out for me in the sense that you're upfront, you're, let's say, very modern in terms of technology, but also being present in social media. But at the same time, I feel that your heart is with you want to provide the best possible care to patients. And that, Andreas, stood really out for me.
Super. Super good summary. I would wish, you are a great role model and that you inspire a lot of young, talented clinicians, be it female or male, to follow your example. And this brings us to the end of this ProTalk series with Dr. Laurence Adriaens. So thanks for listening in. Follow us and subscribe to our podcast on Spotify or Apple Podcast or on YouTube. And if you want to engage with us and you realize you can also ask a question to us, and we are very happy to have your question, this is best done on our Instagram account from Straumann Global. So whenever we have future guests, we try to engage you. We want to let you know, and please post your question, and maybe your question will make it to the next podcast. Thanks for listening in. Thanks, George. Thanks, Laurence.
Thanks, Andreas. Thanks, Laurence.
Thanks, Andreas, and thanks, George. It was a pleasure. Thank you.
Thank you.
Thank you.